Sylvia coming in. She has a bunch of things going on with her, repetitive use type injuries. We're going to be working on her wrists when she's racking the bar. She's feeling it, and when she spins it around, she's getting some pain. So we're going to do some shockwave into there and start the healing process there. And then on her Achilles, on her left, from jumping. So we're going to shoot a little shockwave, acoustic waves into there, and then in her low back. So right through here, we're seeing a little raised up asymmetry through there. So we're going to clear that out and do some pressure point work and hit the shockwave. Let's have you lie face down. All right, we're going to start real low. Just going to send acoustic waves going 3,300 miles per hour. It passes through the normal tissue. You won't even feel anything. And then as we get into any damaged tissues, you're going to start to feel it. Let me know if there's any pain. All right, here we go. No pain?
No.
Okay, so we're just going to map this out. You feel anything? Give me like a number, like 1, 2, 3, 4 for intensity that you feel it.
It kind of depends on the area that you go through.
So stop me at an area that you feel it.
I feel more right there. Go down. Yeah.
Between 0 to 10, what would you give that?
Maybe this is a 5 or 3.
5 or a 3?
Yeah, I don't know.
Let's come down here into the SI joint a little bit.
Yeah, I feel like right there.
Right there. So we're going to stay there. We're at a 0.1 or hertz. Now we're hitting all the pressure points through here. Are you feeling it through there as we go up into here?
Not as much at all.
All right, good. So let's bump the power up. 1.5.
Oh yeah, now I feel it.
Feeling that more? Or not too bad?
Not too bad.
And then when we get down here into that SI,
oh yeah, I feel it.
you feel that?
Yeah.
All right. So up here, we're definitely had more hitting that muscle with the pressure point work that you're feeling.
Uh-huh.
We got it here along the glute and the top of the SI joint. Stop me at the most tender point.
Right there.
Right there.
That's where you were doing that
yeah.
trigger point.
Yeah. Between 0 to 10, what would you give that?
Oh, that's closer to 10.
Closer to 10. Well, you hide your pain very well. Should we turn it down a little bit?
No, it's fine.
Mainly want you like at a 5 to 6 out of 10. 10 out of 10 is too much.
Yeah, maybe this is like a 5, 6. Ooh, I felt that.
Right there.
Ooh.
All right.
Oh, Lord.
Let's hold that.
Ooh,
We got a couple more. We're going to do about 200, 300 shocks right here. We got about 100 more shocks, and then let's jump down to the Achilles.
It's so interesting because it feels like the first touch, and then somewhat your body
Get used to it.
Used to it, maybe?
Yeah, sometimes it clears it out real fast.
Yeah.
Sometimes it intensifies. Sweep through there. Good. All right, good job. I'm gonna bump it way down. Here we go. Not too bad.
No, it's great.
You feel anything at all?
No.
I'm gonna bump it up to a little more power. 0.05.
Right there.
Right there.
Oh yeah, I feel it.
So once we find it, we just stay on that spot. We stay on here for about 10 seconds. I'm gonna angle it in, yeah, right there as I angle it.
Yeah.
Between 0 to 10, what would you give that?
I think it's a 5.
Keep breathing through there. I'm gonna slide off this and kind of go through that area right there. Does that feel superficial, or does it feel kind of going deep?
Spreading?
Feel it spreading?
Yeah, like going other areas.
Mm-hmm.
Ooh, that was a 10. That was a 10.
That was a 10 as we got right there.
I think
just
so.
come through here.
Oh yeah, that's where it hurts.
That's where it hurts. All right, good. So this is going to increase your blood flow.
Ooh, I couldn't detect that one. Sorry. That was a 10.
Yeah. It's interesting. On the other tissue, you're fine. And then as soon as we get right to where you've been having that pain.
Yeah. Yeah, I can handle that one.
You can handle that?
Oh, wait.
Yeah.
I think it depends where you touch it.
Yeah. So we're going to be just right around it.
I think how can I describe this is like a really bad toothache.
Ooh, a really bad toothache. Just filling that cavity.
Yeah, exactly.
stimulation, get some growth factors, get the collagen 1, collagen 3 fibers. Make sure that this heals up good so it doesn't thicken the tissue. All right, let's go with that for today. Let's check your wrist. So we're gonna flip you around. So there's a bunch of little ligaments and tendons right there, little carpals.
Oh yeah, now it's better.
Right
there, I can feel it. That's where it hurts.
Perfect. All right, move that around. Still feeling it a little, or is that way less?
Still feel a little bit, but I think not as crazy.
Yeah, good. Well, this is your first treatment. This takes a couple visits for the wrist. You should definitely do at least 3 on that and see how that goes. So let's see you in a week.
Sounds good.
Do another session on that. Another session on your Achilles. Make sure that's not getting that, and then we'll check in on your lower back. Let's just give you a light adjustment with the activator today.
Sounds good.
So I'll just go. We're gonna have you flip over and
for the low back.
Yeah, for the low back. So we're just gonna see how your hips are aligned. Looks pretty good in position 1. Position 2 looks nice and even. We go up to here, a little more restriction. Quad on the right, so check that. So we know you got some stuff going on here, so we're just gonna mobilize that SI joint. This is just getting nice, precise, specific adjustments. We're just gonna come up your facet joints, L5, 4, 3, 2, 1. And then up through this side as well. Just getting a little motion. I'm just gonna kind of walk up right there, not moving. So once we get the things moving, the body has an ability to heal itself. Just helping the body out a little bit. Sometimes you get a little stuck. See one on the right, it's got a little lateral. We're gonna turn this down. Just get right in here. Good, that's moving better. One more right there. Excellent. Just little pressure points, kind of like what I was doing earlier. Maybe right here, a little bigger adjustment. You okay with an adjustment there? Deep breath in. Let it all go. Good job. Is that painful?
No, but I was like, I guess I was expecting a big noise.
Yeah. It definitely made noise, but not like a...
Yeah, I was expecting that, but...
Yeah. Let's go with that. You're moving better. Let's just recheck you real quick. Forward fold again. Just kind of see how your back's moving.
Oh yeah, much better. It doesn't hurt much.
And come back up. Any pain as you come up?
Oh, no.
No. All right, good. Let's go with that. This is kind of the start because it's been a little while since we saw you. So let's see how your body responds to that. The Shockwave is going to make huge improvements in that wrist for sure, and definitely in Achilles. And then if we need to do more, we can do some scraping and some cupping on that if we need to. But let's see how your body responds. I don't want to do too many things, otherwise we don't know what's working and what's not working. Did lighted little adjustments, pressure point work, things are moving better. So let's go with that.
Sounds good. Thank you.